Hi everyone, welcome to our chat of Wellness and Life After Cancer, co-hosted by Fox Chase Cancer Center and the American Cancer Society. We are live from the American Cancer Society's AstraZeneca's Hope Lodge in Philadelphia, just across the street from Fox Chase. I'm your host, Desiree Behringer-Carton, and I'm so excited to be here with you guys today. I'm also excited to introduce our doctors who are joining us, Dr. Crystal Denlinger from Fox Chase Cancer Center and Dr. Rich Wender from the American Cancer Society. Welcome. Thank you so much.
Good to be here.
Both doctors will share their expertise on how to maintain a healthy lifestyle after being diagnosed with cancer and being treated for cancer. So I also want to thank our host for this event, which is Hope Lodge, Philadelphia, who've let us set up shop here on the third floor in their guest family room, and it's really, really nice of them to have us here, so thank you guys. As you guys all know, facing cancer is so hard. Having to travel out of town for treatment can make it even harder, and just getting that cancer diagnosis puts so much stress on a family. Yet the American Cancer Society has a place where cancer patients and their caregivers can really find help and hope when home is far away. And that's really what the Hope Lodge is all about. It's a home away from home. The American Cancer Society has 32 Hope Lodges across the country and in Puerto Rico. It really offers cancer patients and caregivers a free place to stay when the treatment is far away from home, and they can really focus on their treatment and getting well and not worrying about the added stress of a cancer diagnosis. So it provides that nurturing, home-like environment for the families with private rooms and a variety of resources, and including cancer information, peer support, health and wellness programs. So just really, it's really an incredible place. Just to give you some fun facts about the Hope Lodge here in Philadelphia, the AstraZeneca Hope Lodge. Guests have come here from 30 states and 2 other countries. They've provided, just in the year 2017, more than 19,000 free nights of lodging, just in 2017 alone. So it's just saving families over an estimated $2 million. Can you even believe that? I mean, that is just so much in hotel expenses, and another added stress that families do not have to worry about. And one of the nicest features of Hope Lodge is really that community aspect of the way the community connects with the Hope Lodge guests through volunteering. And I know our Fox Chase, the nurses of Fox Chase staff, have really developed a wonderful special relationship here with the Hope Lodge guests, and they come in as a group and cook dinner for the Hope Lodge guests many times a year. So we are so thankful to Fox Chase and all of our volunteers for that. So we want to tell you a little bit about our doctors here. Welcome again. So Dr. Crystal Denlinger, who is the Director of Survivorship Program at Fox Chase, as well as the Chief Gastrointestinal Medical Oncology. So she's also active in the National Comprehensive Cancer Network, which serves as the chair of the organization's guidelines panel for survivorship. So that's a lot, so welcome. She also recently received the NCCN's Roger Wynn Award for her contributions to improving cancer care. So congratulations on that. And Dr. Rich Wender, my colleague here, is our Chief Cancer Control Officer for the American Cancer Society, a role he began in 2013, and he's also the past president of our local society here at the American Cancer Society in Philadelphia. He's also been committed volunteer to the American Cancer Society for more than 30 years, which is absolutely phenomenal. Dr. Wender worked for 34 years as a family physician at Thomas Jefferson University in Philadelphia, in serving in a variety of leadership roles, and he's led numerous initiatives here locally in Philadelphia, but globally for the American Cancer Society to improve preventive care and chronic disease management with a focus on cancer prevention and control. So he's really the pioneer of the patient-centered medical home, and currently serves as the National Colorectal Cancer Roundtable. So you both have very accomplished resumes, and we're so thankful for what you guys are doing in the community and to the cancer patients and here in Philadelphia and around the country. So thank you so much, doctors, for being here. So they're going to talk to us. We're going to get some questions here. They're going to talk to us about what you can expect of life after cancer, how to stay healthy, precautions for family and caregivers, and all those things. So we want to make sure you please add your questions and comments to the section on this video. We'll answer as many as we can. And a quick disclaimer before we get started, folks. The following content is just informational purposes. We want to educate you guys about, does not create a patient-physician relationship. So if you need clinical advice, make sure, or diagnosis or treatment for any medical condition, please consult your healthcare provider. So, or if you're concerned, of course, I would encourage you to, make an appointment at Fox Chase Cancer Center by calling 888-Fox Chase or visiting foxchase.org, or call the American Cancer Society. We have a 24-hour hotline, 365 days a year, and you can find that number at cancer.org. You can check out our website as well at the American Cancer Society. So let's start off with our discussion, and just one first thing to get going is when is a cancer patient out of the woods? How do you know? We hear a lot about that 5-year survival rate. Can you kind of give us, the 411 on that?
Well, I'll kick it off, and the reality is that every cancer is different and every patient is different. So there is no single rule that applies to everybody. And the reality is today is that many people are cured of their cancers. But even if that likelihood is extremely high, sometimes it's tough to know if you're one of the ones who is cured, the cancer's never going to come back, or if you're somebody who even years later might have a risk. So I'll be curious what Crystal thinks, but we tend to be very conservative about promising cure. But here's the good news: longer you're out, no cancer back, the higher likelihood that you're in that cure group.
That's very promising.
So I think that's very true. It does depend on the type of cancer that you have, the individual characteristics of your cancer, and also sort of the time from diagnosis and treatment. There are some cancers where that 5-year mark might be a little more applicable, and then there are some cancers where 5 years doesn't apply at all. And we know that cancer risk recurrence tends to be greatest earlier on after the completion of therapy, but it doesn't mean that after you hit a specific number of years or number of months that you don't have to worry about it again. But that being said, we also know that there are a lot of people who are cured, and with current therapy right now, cure rates are only going up, which is terrific. And so I think it is important to understand your particular diagnosis and to talk with your healthcare provider about your particular risk of recurrence in your particular disease, because that will then help define when you can breathe that sort of potential sigh of relief, so to speak. And we also know that people who are cured of one cancer or have received therapy for one cancer may also have risks for other cancers in the future. So it's important to make sure that if there are modifications in behaviors, lifestyle, that we talk about those with our healthcare providers so that we can lower the risk of other cancers in the future, as well as recurrence from the cancer someone may have already had.
Oh, thank you so much for that. We hear a lot of the survivors worry about every little ache and pain. What symptoms do they really, truly have to worry about? I know that is hard. That's like kind of an open-ended question, but it's different for each patient again. But what are some warning signs?
There's a team at the American Cancer Society that followed a group of survivors, a large group of survivors for many years, and we asked them, you said, what are you experiencing? And one of the most persistent symptoms that people have is worry and anxiety. And it's understandable, they had a cancer diagnosis. And we just finished saying that it's sometimes knowing that, oh, it's cured, you don't always get that message, no worry. So I'm a family doc, so Crystal treats the cancer and I'm involved in the diagnosis and the prevention and the follow-up. And I always tell patients, you don't have to be your own doctor. And if you're more anxious, which we expect after you've had a cancer diagnosis, you don't have to decide if it's something to worry about, just call. Come on in. And one of the things that primary care docs need to understand is that the anxiety is higher. We may need to do a bit more, see those patients more often, even do some extra testing to make sure that patients have the reassurance that they need.
I think it's important to talk to your patients about persistent symptoms that maybe don't necessarily have a cause that you can easily identify. So usually what I tell my patients is if you have a symptom that is persistent, you can't necessarily attach it to a given recent event, I would like to know about it. And we can evaluate it together. We can make a decision about whether we think it's related to your cancer, whether it's something that we need to work up further, or whether it's completely unrelated. But right, it is not a decision that the patient should make themselves. It really is a sort of shared discussion about what the patient is experiencing, and then we make decisions about how we move forward to determine whether it's something we really need to worry about or whether it's really nothing. And I'd rather hear from the patient that there's an issue and be able to sort of figure out what's going on, rather than either someone be very worried about a symptom and be afraid to call, or to not really hear from somebody when something's going on.
Yeah, always better to be safe than
Yes.
sorry.
Yeah.
So thank you. If you're just joining us now live, we are live at the AstraZeneca American Cancer Society Hope Lodge in Philadelphia. We're having this great discussion with Dr. Wender from the American Cancer Society and Dr. Denlinger from Fox Chase Cancer Center about life after cancer. So they're giving us their insight and their expertise. So thank you again for joining us, and send us your questions. So we have another question. If I'm sick, do I call my oncologist? Who's the quarterback of my care once I am cancer-free in remission? Is it the oncologist or the primary care physician? I would think it's everyone, right? It's both. You have to keep checking out, but I don't know. I'm not the doctor. You guys are the experts.
So I think it changes throughout the course of a patient's or a survivor's trajectory after the end of treatment. We want this to be a shared care model. This shouldn't be oncologist only or primary care doctor only. I think it's important to understand that we have different focuses when we're talking to a patient. As an oncologist, my focus is on recurrence of the cancer and any late or long-term effects related to the treatment that someone's received, and prevention of any recurrences or new cancers. But the primary care doctor is also equally important, because the primary care doctor really manages the other medical problems. They're really important in terms of preventive care, and they're also important to be sort of an intermediary between oncology visits when maybe there's an issue that arises. So I think you actually need both doctors or both healthcare providers involved in order to follow someone appropriately. And as you get further away from your diagnosis and treatment, primary care becomes more important, because we know that risks of other medical problems may outweigh the risk of the recurrence of the cancer. And so over time, oncology may back off a little bit, but primary care is key for every survivor.
And they have to make sure that they each know the medicines that the patient's on, they don't interact with something, right? All those things come into play.
These points are so critical, and I think we have to be really honest and recognize that the state of what we call survivorship care, after cancer care, is still evolving around the United States. Some places, the teams that Crystal's talking about, beautiful, it's going great. Other places, maybe not so good. So I'd want to emphasize that the patient and the family and the caregivers play a critical role here. And this is an area that I think people do need to maybe have their own records available. It's a little easier nowadays with electronic records. Make sure that that when they're seeing a primary care doc, that they understand what cancer they had. Make sure that they connect with that oncologist. So this is an area where a little advocacy, on your own behalf is a big help.
Yeah, you have to be your own advocate. That's true.
And this is where survivorship care planning can actually be important. I agree. I think it's really important in today's day and age, given the fact that you may get your oncology care in one place and your primary care somewhere else, that the patient and the family really understands the diagnosis, the stage of their disease, what therapies they've received, at least be familiar with the things that they've been through. But survivorship care plans and care planning can be really helpful, because it can be a sort of black and white record of what a patient has received that can then travel with the patient from one place to another. So when we talk to our patients about survivorship care plans, and I deliver a care plan to my patients, I say to them, this is a record of the therapy that you received. It includes the drugs you've received, the surgeries you've received, and if you go somewhere outside of Fox Chase, this is something important to take with you. So let's say you decide to move across the country, you may not have your stack of records from the 3 years you've been seeing me, but you will have that summary, and that is something that you can show at the ER if you get into trouble, or if you go to a new primary care doctor, and that is a way to communicate some of the information. But I also think it's important that you don't just rely on that black and white document, that you also really do have a shared discussion with your oncologist about the drugs that you've received and what's anticipated to happen in the future because of those therapies.
It's like a guidebook, and I think it's important for the caregiver to know all this too, and the
Yes.
reactions of present, and then they can take with them if God forbid something happens.
Right.
So, great insight, such great information. So, how often should I see my oncologist? For how long after the treatment should I continue to see my oncologist? I mean, these are all great questions, so keep them coming.
Yeah. So I think it changes. Again,
Yeah.
early on after diagnosis, oncologists will tend to want to see their patients more frequently. Every 3 months, every 6 months. It sort of depends, again, on the disease, the stage of the disease, what the patient received in terms of their therapy. But we tend to see patients, every 3 to 6 months after treatment's over. As you get further away from diagnosis, the frequency with which you see an oncologist can be longer, and appointments can be spaced out. And again, depending on the disease, at some point you may be able to transition back to your primary care doctor with a plan of follow-up care, or you may be somebody who has to see your oncologist annually. And so I think that, again, is part of the survivorship care planning, where we discuss sort of at the end of treatment what the follow-up plan is going to be, and at what point you might be able to go back to your primary care doctor with the necessary screening tests, or whether you continue to see us as an oncologist long-term.
The only thing I'd add to that is that we're actually working with the American Society of Clinical Oncology, American Cancer Society are working together now on providing some guidance about risk, and that the whole community, cancer care community, would use for high and medium risk patients who might need to maintain a closer relationship with the oncologist for lower, and some guidance for patients at lower risk who may be able to transition all of their care back to primary care a little sooner. And then the other thing that I know Crystal didn't quite call out, but I know she agrees with, because we've talked about, even while you're seeing that oncologist, even if that has to go on quite a while, you need to be seeing your
Yes.
primary care clinician periodically too, because it's a heartbreak, right? When you're doing wonderfully with your cancer, but meanwhile there are other health problems,
Because it
blood
could
pressure,
have-
diabetes,
yes,
the stress
that are
of
not being
everything.
addressed. And Crystal briefly alluded to the fact that we have so much good data now on the importance of exercise and of maintaining a healthy weight, that your primary care clinician may be, first of all, we deal with it every day, and we may be able to spend a bit more of our time focusing on that when we
Diet.
see you, rather than
Right.
needing to spend as much time on the cancer care itself. So I think you need both during that follow-up
And
period.
there actually is evolving data to suggest that over time, other medical problems become a bigger issue.
Yes.
Cardiovascular disease becomes a bigger problem for breast cancer, colorectal cancer survivors, other cancer survivors, the longer they get from diagnosis. As an oncologist, I'm not necessarily as familiar with the current guidelines for lipid management or cholesterol management, blood pressure management. Where primary care, this is what they do. We think about expertise, and when you go to an oncologist, you're looking for an expert in cancer care. But for other diseases like diabetes and cardiovascular disease, your primary care doctor is that expert. And so it's important that you have all of us on board, because that's the best way to get the best outcomes. There actually is data to suggest that shared care between oncology and primary care is associated with better outcomes. So it's key.
It's key to be in touch with both.
Yes.
And
Yeah.
again, goes back to being your own advocate.
Yes.
And listen to your body, right?
Mm-hmm.
All right, we're getting some questions coming in from Facebook and some of the comments. We've talked about survivors' anxiety, cancer reoccurrence. One of our viewers, Joe, is wondering about how spouses and caregivers can deal with the anxiety of their partner's care coming back. I mean, that is tough. I mean, being a
Yeah.
caregiver is also so tough, because you see your loved one going through so much.
And it's not unusual that, we've all seen it. We've seen the entire spectrum where the patient is pretty mellow,
Yes.
pretty cool,
Yes.
and it's the caregiver who is,
Yes.
and doesn't want to communicate that to their loved one. They don't want to make them worried, but inside they're really worried. So one of our just fundamental lessons that all of us couldn't believe in more is that it is critical that caregivers take care of themselves. And so everything we said about dealing with the anxiety for the patient's anxiety goes just as true for caregivers. And there are support groups. There are online networks. We have ACS has Cancer Survivors Network, CSN, easy to find. It's the largest online connection, and many caregivers are connected through that. That's not just for patients.
Yeah.
We've produced a beautiful caregiver's guide, which we can make available to folks as well. So take care of yourself. Anxiety is is common. Don't just suppress it. Don't just assume that you're not supposed to share it.
That's right, that's right.
I think as a caregiver, it's also important to ask questions. If you
Yeah.
do have concerns, don't be afraid to ask questions, whether it be with the patient or potentially if you feel necessary, step out of the room and talk to the oncologist or healthcare provider separately if your spouse or patient is okay with that. But I think it is important to actually voice your questions, because if you have a question that is not answered, it becomes its own source of anxiety, and then that just continues to sort of fester. So I think it's important to be able to speak up and ask the questions. And again, just as the patient and the survivor needs to understand their disease, the caregiver needs to understand the disease that they're dealing with.
And it's like a trickle effect, like you said, because if you're not taking care of yourself as
Yes.
a caregiver, then you can't take care of your loved one who really needs your help and support. So are there any specialists that survivors should start seeing because of their cancer experience?
So I don't know that there's any specific specialist that a survivor needs to see. I think depending on the environment in which your care is being given, you might be referred to a survivorship clinic, which is a clinic run by a healthcare provider specifically for cancer survivors. Although in other areas, the survivorship care might be done within the context of the regular oncology visit. I think specialist care is dependent upon the needs of an individual survivor, whether they have late effects of cancer therapy, which are effects that develop after treatment is over, or long-term effects that develop during treatment and then persist. Those may need specialist care depending on what effect you're dealing with. But in general, I don't think that there's a specific person that a survivor needs to see after they've completed their care.
Yeah, this is a team effort.
Mm-hmm.
And so we're talking mainly about your primary oncologist and the primary care clinician, but we face every day that you're talking about genetic specialists, folks who can counsel about family risk and your own risk, multiple types of cancer care, both surgeons, radiation oncologists, chemotherapy oncologists for docs, physical therapy. There's increasing data on the value of physical therapy who have special knowledge of some of the complications that cancer patients experience. So endocrinology, fertility issues, but as Crystal said, it really is dependent on what the effects were of your particular cancer as to which sets of team members help you and are needed.
So true, and thank you for that. If you're just joining us now, we are live at AstraZeneca Hope Lodge in Philadelphia. This is one of the 32 Hope Lodges for the American Cancer Society. So we are so happy you're joining us. We're having this wonderful discussion with Dr. Wender from the American Cancer Society and Dr. Denlinger from Fox Chase Cancer Center about life and wellness after cancer diagnosis. So thank you so much. Keep sending us your questions right there in the Facebook live chat. So we want to hear from you. So to dovetail off that last question a bit, when survivors see their doctors now, what do they need to tell them about my cancer treatment? I guess, you know, they need to make sure, again, it goes back to kind of that guidebook that the oncologist gives, right? And just make sure that they know. Cancer
Care plans that Crystal mentioned earlier are now a recommended accreditation standard for hospitals that are accredited by the Commission on Cancer, which accredits the largest number of accredited facilities. And we're still learning how to use them well. And primary care clinicians are still learning how to interpret them. You know, what do I really need to get from them? So this is, you know, in a way, it's a very good moment in cancer. People are living many years with a cancer diagnosis. People are living many years after a cancer diagnosis. So the focus on survivorship, quality of life, reducing your risk for other diseases is increasing. I mean, this has been emerging. So make sure that your primary care doc knows what diagnosis you had. If at all possible, have that survivorship care plan. If not, connect them with your cancer care team. Let them get the records that they need. And I think the most important thing, and something that all of us have an obligation for, is to make sure that nothing falls through the cracks. There are certain cancers, for example, and certain therapies that increase your risk for a second cancer. And so the recommendations change for screening. It better be awfully clear who's taking charge of that. So, you know, I think the docs themselves have a real obligation here, but the patient needs to make sure that that's been made clear.
I do think that we are getting better at communicating
We
with
are.
each other.
Yeah.
That is one of the things that electronic health records have actually been helpful in, is that
Yeah.
you can develop easier ways to communicate with other physicians, but it is incumbent on the physician to make sure that they are communicating.
Yeah.
And I think, from the survivor's perspective, it's important for the patient or the doctor to understand where you are in your cancer therapy. Are you still on active therapy?
Right.
What therapies you're receiving? Are you seeing your oncologist? And has your oncologist made any recommendations? Those recommendations should be communicated with primary care. And for the oncologist, what recommendations the primary care doctor is making and how those recommendations have been implemented. So, for example, if I'm seeing someone with a history of colon cancer who has recently seen their primary care physician and had changes in their diabetes medicines and their high blood pressure medicines, I still want to know that. And just as I'm sure that the primary care doctor will want to know that the oncologist has recommended that they're due for their surveillance colonoscopy, or they are recently getting a CT scan as part of their surveillance. So I think we need to communicate amongst ourselves well, but I also think it's important that the patient themselves or the survivor can help bridge that gap too.
Wonderful information. Question, I had chemotherapy. How long will my immune system be affected?
So I think it depends on, again, the type of therapy that one receives. There are some drugs where the immune system can be affected for many months out, and there are some therapies that even within the course of 4 to 6 weeks after therapy is over, the immune system has improved. So I think it does depend on the individual drugs that a patient gets, and it is something that you should talk to your provider about specific to your therapies. But in general, most people's immune systems will recover 4 to 12 weeks out of therapy. But again, it's important to talk with your doctor about the expectations for your specific therapy.
One of the things we're focusing a lot on, and at American Cancer Society, Dr. Alfano, who leads our survivorship work, very interested in the role of inflammation. So immune therapy is one thing. Continuing inflammation is also a stress on the body. It may affect risk. And one of the really good pieces of information that's emerging is that maintaining a healthy weight, being physically active, and having cancer can be a very motivating moment in your life, even if you've always had trouble engaging around healthy lifestyles. This is a time where people are able to make some changes that they weren't previously motivated to do, and there are programs out there to help you do it. So, and we have more and more evidence now that the inflammation is reduced through those interventions.
And certain foods cause inflammation too, so again, it goes back to nutrition.
So
right?
the American Cancer Society actually has guidelines for
Yeah.
cancer survivors around nutrition and physical activity, and I think that those guidelines are really important to be aware of, understand, and to try and follow as best you can, because we know, especially in certain cancers, I'm a GI oncologist, so I treat colon cancer, but in colon cancer, adherence to the ACS guidelines is associated with better outcomes. So this is a guideline that they've published in 2012, if I remember correctly, that is available online, that I speak to my patients about all the time. I try to adhere to it myself, but I understand that this is a guideline that is a guideline, which means not everybody is going to meet all of the recommendations at any given moment, but it talks about trying to eat a diet that's more plant-based, that involves a lot of fruits and vegetables, that stays away from red meats and processed meats, a lifestyle that involves a fair amount of physical activity, at least 30 minutes on most days of the week, and limits alcohol intake. And I think those guidelines are applicable not just to the cancers I treat as a GI oncologist, but across the board to all the cancers that we all treat. And that I think is key to improving long-term outcomes with our patients.
Guidelines are being updated right now.
That's
So
there you
we're gonna-
go.
We have new
Stay tuned.
new
So
updates
more
in a couple months.
More
Yeah.
information to
Awesome.
come, so stay tuned. We're getting a question from Megan on Facebook, and she comments, how do you see primary care and oncology working together towards survivorship planning? And you guys have touched on that a little bit, but maybe a little bit more in depth.
It's in a way, as I said earlier, it's a wonderful challenge that we have in front of us. And I can tell you though, because I work across the whole country, that both specialty groups, and when I say both, I mean there are many people involved in cancer care, and there are many actually primary care groups. This is an area of really shared interest. I think there's the recognition that this is a unified responsibility, and it is evolving. And it's one of the reasons why both of us have emphasized that as it's evolving, you may be a part of a system where you're in one integrated system, they've got this down to a science, it's flowing, and you may not. You may travel, you may move. So just make sure that you're being your own advocate to make sure that that connection occurs.
I think the good news is that both primary care and medical oncology actually want to be a part of this. Or oncology, I'm thinking as a bigger group, primary care comes to the table, they are interested. Even at Fox Chase, we have seminars for primary care physicians on topics that are specific to cancer patients. And there are people that are very interested in this and want to know more, and there are people that are very involved in trying to make sure that primary care is a part of the discussion when it comes to survivorship. So I think this is a great time actually to be in survivorship care, because primary care and oncology care together, I think, understand that it is important to work together for the best outcome for the patient. And I think the efforts around trying to risk stratify patients and who needs primary care as their main sort of driver of their post-treatment care versus who needs oncology to drive their post-treatment care is going to be really critical in making sure that everyone's care, their needs are met, but that we appropriately treat people and follow people, that the patient who is at lowest risk is not all of a sudden getting a bunch of scans and blood work and unnecessary doctor's visit, but the patient who is at highest risk is actually getting the appropriate surveillance that they need.
Wonderful. If you're just joining us, we are live here at the AstraZeneca Hope Lodge in Philadelphia with the American Cancer Society and Fox Chase Cancer Center for a great discussion about life and wellness after cancer treatment. We're getting a question from Elaine. Can you still have side effects from radiation 5 years later?
Yeah, some of the side effects from radiation are long-lasting. I mean, one of the classic examples would be skin changes, and they often will never go away and evolve. You're in an area when we do radiation in abdomen and bowel.
Right, so in the diseases that I treat, we typically will see long-term bowel changes from radiation therapy. So you can see issues around bowel frequency, you can see effects from bleeding from radiation changes of the bowel. In general, fatigue can still be a longer lasting side effect from therapy. Skin changes are always a common thing. Hair loss, permanent hair loss in the area where radiation therapy was applied. So I do think there are some long-term changes, and in fact, that is part of the reason why a lot of radiation oncologists will continue to see their patients for many years after the radiation is completed, because they actually are looking for these long-term effects of therapy. And the good news is we actually do have ways to treat some of the late and long-term effects associated with radiation. Certainly in the diseases I treat, using anti-diarrheal medications for people who might have frequent stooling from radiation changes. There are local therapies if someone does have radiation-related changes to the bowel wall. So I think there are options for those treatments. It's important to talk to your radiation oncologist if you still see that person about those changes, and if not, talk to your primary care doctor who can get back in touch with someone.
Great deal of research that is going on in the whole field of radiation oncology, and the new technology is to try to minimize those side effects and really focus those treatments more and more precisely so that the healthy tissue around the cancer is protected.
Wonderful, thank you. Last questions, and this has been such a wonderful conversation. What precautions, this is a great question, so thank you for sending it. Can siblings and other family take genetic testing? What do you recommend? When a loved one is diagnosed with cancer, the rest of the family already worries about taking care of them as the caregiver, but then about their own bodies.
Yeah, so again, I think it also depends on the specific cancer and the patient's diagnosis at the time, of the age at the time of diagnosis. For some cancers, we actually do think about genetic risk and will potentially send a patient for genetic risk assessment. And if that patient is found to have a known genetic mutation, then certainly family members, first-degree relatives should absolutely be tested and potentially followed in a high-risk genetics clinic. But for those who are not known to carry a genetic mutation, which is the majority of our cancer patients nowadays, I think it's important to make sure that you follow the appropriate screening recommendations for any cancer that is screenable. So for colorectal cancer, if you are someone who is diagnosed under the age of 50, your first-degree relatives should be getting their cancer screening at least 10 years before the time of diagnosis of the affected relative. For breast cancer screening, that may change. The frequency with which you get a mammogram also may be different depending on the age of the patient in your family. In general, I think most people who have a family member diagnosed with cancer should be following the healthy lifestyle recommendations put together by the ACS and because I think those are key. We know that lifestyle and diet and exercise actually do play a role in cancer incidence and risk. And so if you are someone with a family member diagnosed with cancer, I think it's very important to be thinking about how diet and lifestyle, smoking, all the things that could put you at higher risk, how they play a role in your future life.
And the quickest little final addition, I see too many families that did not know that their family member had a cancer, or they did not know where that cancer started.
Family history.
And I understand that, and I'm respectful of privacy, and we get that, but the world is changing, and this is a real act of love for your family members.
Yes.
Please share everything you know about your cancer. Make sure people are aware, because it may change their risk and their
Absolutely.
testing. So it's a tragedy when we hear somebody get a cancer prematurely and there was a family history, they didn't know it. So while we respect privacy, I think this is a new era. I think people really, it's a loving act to share this information.
Yeah, and the word cancer used to be so taboo, but now we have so much information, and
That's
knowledge
changed.
is power. You have to, make sure you tell your
Sure.
family members and your loved
And we
ones.
know that there are new genetic syndromes and
Yeah.
familial risk syndromes that are being defined. So I think you as the patient, sharing your diagnosis and treatment history with your family members is key, because it does matter someday when they're sitting in front of me.
100%. This has been such a wonderful discussion. Thank you so much for your expertise and your insight. We so appreciate you guys taking the time out of your busy schedules for joining us. So thank you, Crystal. Thank you, Rich, as always. We appreciate it. And of course, we want to thank the AstraZeneca Hope Lodge here in Philadelphia for hosting us. We want to thank all of our viewers. So make sure you keep putting in your questions and comments in the chat box, and we'll try to get to as many as we can. We've learned so much about living well after cancer. There's so much information. So make sure you go to our website, the American Cancer Society, cancer.org, and also visit Fox Chase Cancer Center at foxchase.org/survivorship. Again, please continue to check in the comments section on this video and add anything you'd like. We have follow-up questions that we'll be answering, and we look forward to seeing you next time. Thanks so much for joining us.